Ask Dr. Tell is a presentation of Ryan Ranch Medical Group, providing comprehensive, quality health care for your entire family. Proudly serving the Monterey Peninsula. Now, here's your host, Dr. Tell Franklin.
Hi. Welcome to Ask Dr. Tell radio and TV show. I'm Tell Franklin, MD, Medical Director. We're airing live simultaneously on KYMB Comcast Channel 19 and KNRY 1240 AM. Welcome back to another edition. We promise we're going to make this very, very informative and passionate and exciting and give you the tools to live healthier, to live more passionate about life. I said that twice. Hi, Mira. How are you?
I guess you're really thinking about
today.
life and...
Yeah. Well, I kind of there were some things that I just wanted to talk about, and I guess I feel really passionate about it. I got a phone call this morning, and it was from the University of Southern California School of Medicine, and they were having a panel discussion on the challenges of the healthcare crisis. And I got to thinking about it and realized that we don't do enough to empower ourselves to be healthier. Because I think the secret of medicine, the secret of healthcare, is to really optimize your own immune system. And what I mean by that is that I don't think there's anything that's more powerful in trying to minimize cancer, heart disease, diabetes, any kind of degenerative illness than our own immune system. And there are some secrets and some non-so-secret ways to really optimize that so we're not always being a victim. And what I mean by that is that I don't believe that cancer and degenerative diseases and heart disease is inevitable. I think too often we become a victim. And what I'd like to say is I want to show you a way to form a protective bubble around you and your loved ones so that you can prevent chronic illness.
Isn't it more of a lifestyle?
I think a lot of it is lifestyle, so I'm going to go through a couple of those, okay? What I think are the most important points, okay? I think first and foremost, as in any kind of journey, and healthcare is a journey, is that you need to find a family doctor or a primary care physician, a board-certified internist or family doctor who knows you, who can partner with you, who really, is available 24/7, because oftentimes, problems and questions may arise not between the hours of 8 to 5, as you know.
As you well know.
And so it's nice to be able to have somebody's home number or cell number and to be able to call them and say, hey, doc, I got A, B, and C. Is this something I should be concerned about? Or is this something that I need to go to the emergency room? Or can you meet me at the office? Or can I wait till next week? Or is this really nothing? Because I think oftentimes the worst thing is kind of the unknown, things that we just don't know.
Right.
And so I think the first and foremost is to interview different physicians and find somebody who you feel like makes good eye contact, someone you feel comfortable about. And not to be metaphysical, but we all kind of have a different kind of energy or kind of persona, and you just kind of, I feel comfortable with this person, I don't feel comfortable with this person. I want to have a man, I want to have a woman, I want to have someone who's a little bit older, I want to have someone who's a little bit younger. Right. Oftentimes patients want someone around their age so that the doctor's there for a long period of time.
Right.
But then again, a lot of people want somebody who's got 20 or 30 years of experience because they've seen a lot. And then other people say, you know what, I want someone who's just out of training because they know the latest and greatest.
So what are some questions that your patients ask you when they come in to meet with you?
Well, I think that the questions that they ask are, in general, the nonverbal questions. And what I mean by that, I think they're often looking for a physician that makes good eye contact.
Okay.
They're looking at whether or not if I'm busy on the computer or in the chart writing, or whether or not if we're really kind of relating. Because if I'm not relating during the initial interview, that's kind of a foregone conclusion that preoccupied with something else. The second thing is that you really want to go into an office that has electronic medical records. that has
right. You said that before.
yeah, that it's you don't want to have to call an office and they kind of scratch their head and go, oh well, we'll try and find your chart or your chart's lost. You know, the other thing is that if somebody calls me at 7 or 8 o'clock at night, I can go on the computer and I can fill up their chart if I'm not exactly sure what medicines, you know, they're on or what their allergies are or what some of their chronic illnesses. So I think that's important. I think the third thing is you want to have someone who's board certified. Someone who keeps up with continuing medical education and someone who's either board certified by the American Academy of Family Medicine or the American College of Physicians. So either a board certified internist or family doctor. So there are two different types of primary care physicians, internal medicine and family medicine, except if you're 6 or 5.
Okay.
Because then there's pediatricians too.
And what is the difference?
Well, the difference is the pediatricians usually take care of kids starting at age infant to usually about 17 or 18.
Okay.
And then family doctors usually see kids. We see kids in our office from the age of 3, and we obviously see people up to
whenever.
Yeah,
whenever that magic number is.
Usually about 120. We cut it off.
Okay.
There.
Well, that's always a good number.
But and the big difference between family medicine and internal medicine is really that family doctors also see kids.
Okay.
Whereas internal medicine doctors usually don't. But the truth is that all doctors, and this is a good question to ask when you want to sign up with somebody, is what do you specialize on? What's your take on this? And to really ask some thought-provoking questions. Who do I call at 8 o'clock at night when I'm ill? You know, who do I? Do you have same-day appointments? Do you have next-day appointments on a regular basis? How often are you going to want to see me? How often do you do blood tests? Do you keep up and do you do continuing medical education?
Okay, so question for you as a physician. Who do you go to?
Oh my gosh.
What do you do? Because that's what people are going to want to emulate.
Yeah.
They see a doctor. What does a doctor do when the doctor's sick?
Yeah. Oh, God, you put me on the spot
Well,
there.
just curiosity.
Yeah. So I do have a family physician, and when I've needed in the past to see specialists, I see specialists.
So you have the ability to diagnose.
Well,
yourself?
I try not to. No, it's a good question, and it's kind of one of those questions that I think that we feel a little bit uncomfortable with, but I'll answer it for you. Is that I personally don't have any chronic illnesses, but I do believe in prevention and wellness. So I think on two sides to it is one is on a daily basis I take care of myself. So I eat healthy.
Live what you talk
I
about.
exercise. Yeah, I walk the walk. I meditate every day. I do relaxation exercises. I have a wonderful, wonderful, wonderful family. I have a great job and I have great friends.
So you have all of those things that would prevent.
But things can still happen. Even if you do all the right things, things can still happen. So on a yearly basis, I do go in and get, a man's physical, and I get all the blood work done, the cholesterol, the lipids, the HDL, the LDL, lipoprotein A, hemoglobin A1C. So I do all those tests, and I do that on a yearly basis, unless I had another complaint or another problem.
Okay, then you'd go to a specialist.
No, I'd call my family doctor.
Oh, right, okay.
See, what happens is that oftentimes people think, well, if I have this problem, I'll go to this specialist. If I have this problem, I'll go to this specialist. And I think that's where the healthcare crisis comes in. Because oftentimes first and foremost, you want to have a captain of the ship.
Right.
You want to have somebody who's in charge. And oftentimes you think it's your prostate, or you think it's this, or you think it's that. But before you look at the trees, take a look at a distance, look at the forest and say, yeah, it might be that, but I think that first you want to see that conductor and you want to see the captain of the ship and let him or her guide you. Because I think too often if you go to a specialist and he or she isn't able to diagnose you, then you go to another specialist. And then you go to another specialist, and finally you're caught up in this maze. You've had x-rays, you've had MRIs, you've had CAT scans, you have blood tests, and you kind of say to yourself, well, nobody ever, and I think if you went to a primary care physician, they would be your guide to say, here's what we do. It's almost like if you go hike Mount Everest. You don't say, whoa, look at that mountain up there. I'm
going straight to the top.
I'm going to go straight to the top. You want to have some good shepherds who, along the way, with some benchmarks, and someone who kind of coordinates it. I think that family doctors, internal medicine doctors, and specialists run into trouble when they try and treat themselves. You know what
Okay.
they say? You get what you paid for. So if you're asking a doctor in the hallway at the hospital or at the clinic about this or that,
Right.
yeah, it's
Well,
not.
they're just going by what you're telling them. I mean,
Right.
just like anybody calls you, you really don't have all the information. Right now, my foot is hurting, so I'm going to tell you just about my
Oh my
foot,
God.
you know?
Yeah.
So you're not hearing how the foot was injured, or if it was injured, it could be something
Right.
internal. So, yeah, I guess people would just.
So the
What's the
caveat
issue?
to this is do not rely on the emergency room. Do not rely on an urgent care or a doc in the box for the cold, the flu, your cholesterol, whatever. You need to have somebody, a board certified family doctor internist who's available to you 24/7, someone who knows you, someone who you can develop a relationship with over the years. Because it's not just about what a particular blood test shows, but it's how it changes, how the interval changes over a period of time. I'll give you an example. I just saw a young man who is 41 years old, and his PSA was normal, and I sent him for a prostate biopsy because the interval change had gone up so significantly. And I was just called, and he's got prostate cancer, but luckily we caught it early, and he's very, very grateful. So it's not about just reading a chart, but it's about really going to see someone who really knows what's going on. And I think we're going to go to break. Are we going to go to break? We're going to go right to break, and we'll be right back with you.
He's taken me through something that was a life-threatening illness and identified something that I don't think any other doctor would have. And because of that, I have 100% reliability in him.
Everyone deserves to have a physician that's their advocate, who's there for them 24/7. Call us, Ryan Ranch Medical Group, 647-3190. Let us be your partners in health and well-being.
You are listening to Ask Dr. Tell radio program, a presentation of MD Weight Loss. MD Weight Loss is a lifestyle program about regaining control over your health and life. Designed by the Ryan Ranch Medical Group, their weight loss team combines critical medical information with the latest FDA-approved prescription weight loss medications, education, counseling, and support, providing an individualized plan unique to your metabolism, body, and lifestyle. Being overweight is a medical problem that should be addressed by a medical doctor. MD Weight Loss is about losing fat and getting into the best shape of your life. Discover the lasting difference a physician-monitored weight loss program can make. Call today and make an appointment for a consultation at 831-647-3190. That's 831-647-3190. Thank you for listening to the Ask Dr. Tell radio program.
Welcome back. I'm Tell Franklin, MD, and we've been talking here about the importance of having a primary care doc, either a board certified or board eligible family doctor, internal medicine doctor. So let me just summarize for everyone out there, and let me give you the phone number. If you have any questions, 375-1919, 375-1919. Dave Johnson, are you awake back there? Is there to answer your calls, and we'll put you live on the air. If it's of a personal nature and you want to ask me a medical question, feel free to email me at telmd.com. So we've been talking
at AOL.com.
Sorry about that.
TellMD at AOL.com.
So under the description for co-host, make sure you put that there. Remind me to get the last call numbers. I appreciate it. So the importance of having a family doctor, somebody who knows you, someone who's available 24/7, someone who's board certified, someone who keeps up. Somebody who has electronic medical records, so you want to make sure that just as much as they keep up with the medical literature, they're keeping up with the business of medicine. And you'd never want to call a doctor's office and they say, you know what, we've lost your chart, you know. Somebody who's available 24/7, someone either you get their phone number, your home number, they're in a call group. You don't want to get an announcement that says, go to the emergency room, go to your local hospital. That's how healthcare costs rise. Now, certainly, if you were in a bad car accident, if you had a bad fall, if you're having chest pain, if you have weakness on the side of one side of your body and you feel like you're having a stroke, you lose vision. I mean, something major like that, you want to call 911 and you go into the emergency room. But if it's a medical question, if it's something about your blood pressure, your blood sugar, you just don't feel well, everyone needs a family doctor. I mean, it's been shown statistically that people who have family doctors have less incidence of heart disease, diabetes, and chronic illness. So the second thing is, I know we're moving along here kind of
ahead,
slow.
that's good.
Second thing is, we might have to put this into part 2 and part 3. The second thing is, know your genetics. I mean, oftentimes in families, they don't like to talk about things like cancer or heart disease or lupus or autoimmune diseases, but you want to be able to draw out on a chart your mother, your father, your brother, your sisters, your aunts, your uncles, and your grandparents on both sides, and say, this person had heart disease at the age of 52. This person developed diabetes or was born with this or born with that. It gives you an idea of what your DNA is. Now, your DNA is not an absolute. It doesn't mean I'm going to get this particular illness. But what it does mean is that you may have a certain risk. The word I like is that you might have a propensity. That's a big doctor's word.
Okay.
You may have a propensity. You may have a risk for developing a certain illness. So it gives the physician, him or her, some ideas about how to be able to detect illnesses at the early stage. And when you're able to pick up diseases at an earlier stage, you're more likely to minimize their side effects and the ramifications and the debilitation that they may cause. So find a family doctor, know your genetics, and look at the intervals. So when you look at your cholesterol, when you look at your PSA, which is the test that we do for men for prostate cancer and prostatic diseases, you want to look at the interval change. So get a copy of it. In my office, we actually plot these over a period of time so that you can see how people change over a period of time. You don't want to look at those numbers as an absolute in a particular, finite time. We're human beings. We're growing, we're building, we're doing things. So you want to see what it is over a period of time. The other thing is that you want to say to the doctor, if he or she wants to put you on a medication, say for cholesterol, say they want to put you on something like Lipitor or Zocor or Privacol or something like that, you want to say, are you sure I need it? Is it definitive that I really need it? I'll give you an example of this. And I say cholesterol because cholesterol is probably the most prevalent illness in our society, along with diabetes and hypertension. And oftentimes, doctors check what we call a lipid panel. They check your cholesterol, your LDL, your HDL, and your triglycerides. You want to write that down, folks? I can say that again.
Now,
your total cholesterol, your HDL, your LDL, and your triglycerides.
So, at what age
I
would
was on a
somebody
roll
come
there.
in? You were
Yeah,
on a roll. But so I come into the office in my 20s.
Yes.
I have family history of
Yes.
high cholesterol.
Yes.
Is it at that age, or would you say, let's wait till you're 30? Is there an age where you would start testing?
Well, nowadays, I think it's actually good to start as a teenager.
Really?
Because heart disease takes 20, 30, 40, 50 years to develop. Let's get it early. And the first signs of early heart disease start at, ready? If you can guess what age, we're going to have a little quiz here, 375-1919. If you can guess the earliest age, the first sign of heart disease in your coronary artery starts at what age? 375-1919. We will give you a, what?
Check
How
out.
about dinner with Jim Vossen?
There you go,
Okay.
Jim.
How about
he
Jim?
would love that.
He would love that. It's Spanish Bay, and Jim can pay for it. Okay?
That's a deal. I
Okay.
don't think anyone can refuse.
Yeah, okay, so we'll give him that. He's our local celebrity here. So give us a call, 375-1919. Tell us what age heart disease starts at. Okay?
I think there's babies born with congenital heart
Congenital
disease.
heart disease, you're right. But because of the diet that we have, the high saturated fat diet, the predominance of animal protein and animal fats in our diet, heart disease actually starts at...
Okay, since nobody called, he's going to tell us.
Yeah, go ahead. You take a guess.
I would
Put you
say
on
in
the
your
spot.
teens. If you're checking
Yeah,
them in
you're
the
right.
teens.
Yeah, you're right.
Possibly the teens.
Usually around 13.
Wow.
Usually 13.
So that's about
So it's
puberty
not.
for
So it's not a
most.
bad idea to start checking cholesterol when someone's 15, 16, or 17 years old. The other thing is that again we go back to the genetics, that some people have a genetic predisposition to what we call hyperlipidemia or high cholesterol. They actually have what are called familiar occurrences that run in family, and people actually have a certain genetic preponderance to developing it. So the earlier you can start on a clean diet, a plant-based diet, what we call the Mediterranean diet,
Right.
the sooner we can reverse it.
Now, a child comes in, or a teenager,
Mm-hmm.
and do you put them on medication?
Usually not. Usually
That would be a
not.
diet change.
Yeah, I think most of the time, I mean, it depends upon what other risk factors somebody has or what we call comorbidities people have. Initially, we don't try pharmaceuticals. Now, again, doctors are like anybody else. Different doctors have different ways of doing medical care. So in my practice, not giving myself a plug, but in my practice, I try diet,
avoid it.
diet, and diet. And what I mean by that is working with people with foods and working with people with lifestyle, and that medicines can be implemented, but first we should try a good 3 to 6 months or even a year to see if we can do it. Because you got to remember that medicines have side effects too.
Right.
And
Right.
the medicines are always there, and you can always use them.
Well,
But-
if you read all these disclaimers or you listen to them on the commercials,
Right.
you really don't want to give any child
Yeah, yeah. No, I wouldn't say
any of those medications.
I-
There has to be a natural remedy.
Well, actually, especially young people, women, you don't want to put women on who are childbearing age on these medications. But again, there's always exceptions, and that's why, folks, it's really good to have a family doctor and somebody who you really know. So what I want to get to is that when you go to the doctor and that he or she says your cholesterol is high, you need to be on medication. There are different components of the cholesterol besides the total cholesterol, the LDL and the HDL. You can actually look at the size of the lipid molecules of what's called LDL pattern A, pattern B, to see the buoyancy and the density. So ask for the next step, and that's called ready for this, folks? It's called a gel electrophoresis. Ask your doctor about it. It's done here in Monterey. We do them up at Community Hospital. They're done at SVMH. Call and get the answers. The only way to have excellent health care is for you to be an advocate for yourself, an advocate for your family, and truly, truly have a partnership with your physician and ask the right questions. We're going to go to break. This is Tel Franklin, MD. Be right back with you. Being overweight is really a medical challenge, and therefore you should see a physician so that you can understand your metabolism and understand how you can combine carbohydrates, fats, proteins, so you can optimize your health and lose the appropriate amount of weight. To really achieve lasting difference and to get as healthy as humanly possible, you deserve the best. Call 647-3190, Ryan Ranch Medical Group. Let our physicians be there for you.
You are listening to Ask Dr. Tell radio program, a presentation of Ryan Ranch Medical Group, offering a full range of medical aesthetic services for men and women designed to revitalize and restore damaged or aging skin using non-surgical, non-invasive techniques. Aesthetic services include Botox Cosmetic, Juvederm, laser treatment services, photofacial laser skin rejuvenation, laser hair removal, and acne treatment. When you look your best, you feel your best. Call Ryan Ranch Medical Group today for a consultation at 831-647-3190. That's 831-647-3190. Be sure and ask for the radio show special offer.
Welcome back to Ask Dr. Tell radio and television show. We are simultaneously broadcasting on KYMB Comcast Channel 19 and KNRY 1240 AM. I'm Tel Franklin, and I'm here with my guest, Mira, and I am a board-certified family doctor, and actually I am in practice here locally at Ryan Ranch Medical Group. So, we went to break. So we
And
went
of
to
course,
break.
my mind started
and
going.
Mira's asking me all these questions, and I'm saying, ask when we come back. And she's
Okay.
asking me another question. Ask when we come back. I said, Mira. She says, well, why? I said, well, if you're asking me these questions, then other people have the same questions. So
You had talked about questioning when the doctor prescribes, says you have high cholesterol,
Right.
we're going to prescribe these medications, and you said, make sure that's what you need.
okay.
Take it to the next level. Well, we all know that doctors have egos.
Yeah.
And in many ways, patients think of them as God and they have
Yeah.
all the answers. So how do you ask for a second opinion or question that diagnosis without offending physician? What's the safest way to do that?
Well, first let me say that excellent medical care occurs when you have an open, honest relationship with a physician that knows how to listen.
Okay.
Excellent medical care occurs when you're able to partner with a patient, develop that relationship, and individualize the care. If you see all the patients with high cholesterol, hyperlipidemia, hypertriglyceridemia, high lipids, high cholesterol, high triglycerides, and you treat them with the same medication, then it's kind of like one size fits all.
Right.
I'm not even sure then why we needed to go to medical school. So the key is to really individualize it. So I think you can ask questions and you can say, Dr. Franklin, I understand that my cholesterol's high. I understand that I have a brother who's 10 years older than I, and he's already had a heart attack, and that my father never saw 50, but do I really need to be on these medications? So, you just say, I'm really, I think that's the key of having a good physician is someone you can say, listen, I got friends that can't run anymore. They have side effects. I have friends that XYZ happened, their liver, whatever it might be. I mean, there's a lot of talk out there about side effects, but one of the side effects of a lot of medications is
Death.
Well, death.
If you listen to those commercials, you're like, oh, gee, sign me up.
Yeah.
I'll risk that.
Yeah, but you got to weigh the pros and the cons. That's not what I was going to say. But a lot of the side effects or not benefits of these medications is they actually prevent deaths. They help you live longer, and they help you live healthier. Medicines work, but not all medicines work for everybody. And so by getting it individualized for you, by having a physician, in case you have side effects, that's available 24/7, then you mitigate those side effects.
Okay.
But if it was so easy that everyone takes a particular medicine and comes back in a year, then medicine wouldn't be so complicated. But yes, the side effects are real. The side effects need to be taken seriously. You need to be educated about it. And that's why the whole rapport of take the medicine, the doctor gave it to you, and shut up doesn't work. It's not good medical care.
Okay.
And so the relationship and the communication has to be back and forth. It has to be two-way. And you need to be able to say to the doctor, whoa, I'm not sure I want to go up to 40 milligrams,
Right.
or tell me about this, or, if you don't have that comfort level, then maybe find another doctor or bring somebody in with you who can be your advocate, be your partner, because otherwise you're going to go home and you're not going to take that medication anyhow, and you'll just say, why did I ever spend that $20 on my copay to begin with,
Right. It doesn't make me feel good.
Yeah.
Okay, so my next question was, you had kind of talked about Lipitor and Prevacor, I believe.
Prevacor, yes.
Okay. How do you, if they all treat the same symptoms,
Right.
how do you know which one to prescribe? Which
Okay.
one's for me, which one's for you, and which one's for the next person?
Okay. Well, there's a reason why we went to medical school, and the reason why
I
we have the
believe you.
extensive training. So it's not about, even though you have very similar medicines in a particular class, there is a different population that you treat with one versus another. Again, it's about individualizing it. Again, it's about sitting down with somebody and talking for 15, 20 minutes, 30 minutes, really understanding what their risk factors are, starting slow, starting at a small dose. And again, it's the physician's experience and understanding what other risk factors are. Unfortunately, oftentimes when people have high cholesterol, that's not their only problem. We look at cholesterol as being isolated problem. Well, I only have this problem. It just doesn't work like that. We look at the body as having different systems, but really it's multifactorial. It's really the whole body. We need to look at the whole picture. I think when we just look at it individually like that, we run into trouble.
Okay, so.
Well, I don't need any callers. I got you here.
I know.
Yeah.
Well, you started talking and
Yeah.
things started moving. Okay, so a patient comes in, they have high cholesterol, they go on to medication.
Right.
Okay. But in the interim,
but-
they've also changed their diet
Right.
and started exercising.
Right.
Does there come a point where they no longer need the cholesterol medicine and
Yeah.
you can take them off of it? Or is it you've committed to a lifetime of a pill?
Well, it's a great question. You should become one of my patients.
Guess what?
Yeah, I know you are. Okay, so it's multifactorial.
Once
So
again.
it's a multiple approach. So it's diet, it's stress, it's exercise, it's vitamin D, it's CoQ10, it's looking at their vitamin
Big old
supplementation.
puzzle.
It's a
I
puzzle.
guess it's not as simple
It
as I
isn't,
thought.
medicine isn't linear. Well, A plus B equals C. And oftentimes, I would say in about 99% of the time, I've tried diet and lifestyle changes for a good 3, 6 months, and sometimes even a year, and have exhausted those possibilities. Now, all that being said is, do some people do some people back down on the medications after they've been on it for? Absolutely. Sometimes it takes a while for someone to really change and to really make those differences. And after 4, 5, 6 months, sometimes even after a year or 2 years, it's not unusual for me to take someone who's on 20 or 40 milligrams and move them down to 5 or 10. Usually it's not a case where I can just stop the medication, but oftentimes I can minimize any side effects by reducing the dose.
Okay. Okay. That answers it.
You should become a professional interviewer. You do a very good job of this.
A lot of questions.
Okay. So,
Okay.
can I go on? Or
Yes,
or
now
got
you can
some-
go on. I'm okay.
Okay. So a couple things about the other side of the equation is that, oftentimes I'll see patients who know that I'm a family doctor, and after medical school I did acupuncture, so I have kind of a holistic approach. Oftentimes bring in these bags of vitamins. And, I'm going to tell you folks is that there is one vitamin that everybody should probably be on. Again, talk with your family doctor about it, and don't just take the vitamins. But the one vitamin I'm going to mention is,
D.
yeah, vitamin D3 has really been shown to reduce mortality and morbidity from heart disease, diabetes, chronic illnesses. So vitamin D3, which is the active form, people should be on. But remember, first you have to know it to remember it. A, D, E, and K are the fat-soluble vitamins. So after you take 1,200, 2,000 milligrams, whatever it be, after 3 or 4 months, you should get a level check because they are fat-soluble. So you just want to just start taking a handful of vitamins.
Okay.
Again, that's why it's good to have a physician. I'm not saying you necessarily need an appointment, but somebody who can monitor these levels, someone you can talk to and understand what kind of state your kidneys are in, your liver in. You don't want to wait till you get to the end of the cliff and fall off.
Of course
not. Everybody's saying, watch out for that
But
last step.
Most people, myself, up until this show,
Yeah.
I have to tell you, I really think I'm healthy. Why go?
Right.
So, but I do have a new perspective on it. I don't want to show up in the office one day and find out I have all of these things because I thought I felt good until this point and
Yeah.
things were shutting down and I wasn't aware.
But let me tell you a little story. Okay, should I tell the story or we want to go to break?
Tell the story.
Okay, tell the story. Okay, so I was thinking about this. So what if, and I know this is a little bit far out there, but what if, and this is, out there in left field, but it's my show, so let me
Go as far left as you want to go.
Okay, well, I don't know if it's left, but let's say we had, God forbid, we had airplanes falling out of the sky. Let's say we had planes that were crashing.
Okay.
Every other day there was another, airline that went down. We wouldn't say, listen, we need to train more mechanics and have more airplane repair shops around the country. But if you think about it, I know it sounds kind of silly and maybe even a little bit morbid, but if you think about it, every day people are rushed to the hospital with chest pain, shortness of breath, heart attacks, pulmonary embolisms, and we don't do enough to prevent them from going into the hospital beforehand. People often say, well, what do you think about the healthcare crisis? I think more about what do you think about the sick care disaster? And I think, one of the main things that I want to spread, one of the main things about the themes of this show is to get people to make those necessary lifestyle changes so they can avoid that trip to the emergency room at 7 o'clock at night, 2 o'clock in the morning. Too often we're at fast food restaurants 2 and 3 times a day, let alone 2 or 3 times, a week, and we're not having our cholesterol checked. We don't know. Do you know that only 50% of people who have diabetes even know they have diabetes?
I believe
I
it.
just saw a guy in the emergency room, his blood sugar was 780. He said, yeah, Dr. Franklin, someone told me about 3 years ago my blood sugar was a little high. And I said, but I'm feeling fine. Why should I go? So it's to answer your
Because
question.
you got used to feeling fine with blood sugar that
or-
high.
Right, he got used to it, or he just got used to feeling poorly and
Right.
said,
Just
I'm
just my
48 years old,
age.
yeah, and so without ever having it checked. So what I say to you is you don't need to be a victim. And seriously, life is truly a miracle. And the way to really embrace that miracle is to have excellent health. And as health is like any other journey, you need to partner with a good family doctor, a good internal medicine doctor, someone who really knows you. And make sure you have benchmarks along the way during the year so you're not going to fall off that cliff, so you don't end up having that heart attack or stroke. I'm not saying we can prevent all diseases, but about 85%. We'll be right back with you. I'm Tel Franklin. Everyone deserves a family physician who really knows you inside and out, keeping you healthy physically, mentally, emotionally, in every way possible, so you can get excited about all the medical problems you can prevent from ever occurring. That's what optimal health is all about. Everyone deserves to have a physician that's their advocate, who's there for them 24/7. Call us, Ryan Ranch Medical Group, 647-3190. Let us be your partners in health and wellness.
You are listening to Ask Dr. Tell radio program, a presentation of the Ryan Ranch Medical Group. For those seeking an intimate one-on-one partnership with their physician for a more individualized approach to healthcare, Ryan Ranch Medical Group offers MD VIP personalized healthcare services. As the first MD VIP affiliated physician to be appointed on the Monterey Peninsula, Tel Franklin MD delivers personalized preventative health care using his own creative approach termed appreciative medicine that applies to a blend of Eastern and Western philosophies. For more information about the MD VIP program, call Ryan Ranch Medical Group at 831-647-3190. That's 831-647-3190.
Welcome back. This is the Ask Dr. Tell radio and TV show. We're airing live simultaneously, casting on KYMB, Comcast Channel 19, and KNRY 1240 AM. If you have any questions today, give us a call. We're here to answer any of your questions. We'll put you live on the air, 375-1919. We're here for you. So we're going to break again. You're always asking these questions in break. You come up with them.
I don't want to interrupt because it's interesting what you're saying. So back to vitamin D.
Okay.
I take vitamin D every night.
Okay.
The weather's been better. The sun has been out. I know you get vitamin D naturally from the sun.
Okay.
Can I cut back on the vitamin D since I'm spending more time outside? Or would that throw the whole system off?
Well, it won't throw the whole system off. So in general, when you check vitamin D levels, and the way you check it is you get what's called a vitamin D 25 hydroxyl level. Boy, that's a mouthful, isn't it? So
everything you come up with is a mouthful.
The level should usually be, depending on the lab place you go to, it's usually somewhere around 30 to 80. You want to try to be on the higher side. Again, talk with your family doctor about it. But generally, no, you're not going to get that much from the sun, just on 1-2 days or even a week or even a month of exposures. But again, vitamin D is fat soluble, so you want to get a level checked.
Can you go too high? Can you have too much in your system?
You can. I've had a couple of people, sometimes people say, well, Dr. Franklin put me on 1,500 or 2,000. So, we live in America. We live in Western society. So if 2,000's good, I might as well take 4,000 or 6,000 or 8,000. It's got to be even better. I'm going to live forever. And I did have a patient who I checked last week, and it was 124, and that was the highest. And boy, you talk about palpitations. I got a little chest pain when I saw that.
So what will happen? I mean, what are the symptoms of having it? Do you become toxic?
You can become toxic. So the best thing is just to stop it.
How do you know when you have too much? How does this patient know to come to you?
Sometimes you get some bone pain. Sometimes you get really quite fatigued. But normally you're not going to have any symptoms.
Okay.
But again, whatever vitamins you take, you want to have a level checked. You don't need to have a level checked, every month, but certainly, twice a year, 3 times a year. And remember, folks, if you haven't been on vitamin D and all of a sudden they're going to start it, talk with your family doctor about it. Make sure you're metabolizing it correctly. And usually about 2 or 3 months later, I do check a level.
Okay, now you, like we have already talked about, would rather someone change their lifestyle, change their diet, try to do it on your own before prescribing. Do all Western doctors subscribe to this way of thinking? Because do they know vitamins and minerals?
Well,
I mean, that's kind of questionable. You go in there for prescription medicine, not exactly vitamins.
Right. Yeah.
So you really want to find a doctor that's
Again, that was that was the first thing that we had talked about initially, was finding a physician, understanding what his or her philosophy is on
Right.
healthcare. I think more and more people, more and more physicians, more and more healthcare providers are becoming more educated about the importance of diet, of nutrition, of stress reduction, of checking hormones in the middle of life, of talking to you about sleep patterns, of talking to you about stressors and what are the triggers from stress. But to be honest with you, I don't do a survey of my colleagues,
Right,
so
of
I don't
course
really
not,
know, and I'm certainly not a spokesperson for 24,000 family doctors across the United States. So I don't really know, but I would hope so. It's certainly, I adhere to that it's got to be multifactorial. You've got to take in the whole human being.
Okay.
And besides just talking about sleep patterns, vitamin D, talking about the importance of fresh fruits and fresh vegetables, organic sources, staying hydrated, talking about how do you know when you start getting stressed, but more importantly, kinds of things like Tai Chi, meditation,
manage it.
that you can do on a regular basis so you don't get to that crisis. And having certain barometers that so you don't just fall off that cliff at the end. And so, but having a family doctor that you can talk to and be more proactive. I think too often, medicine is a reactive process. We go to the doctor because we have a problem. In fact, our problem, if you think about it, is actually our ticket to get in there. Oftentimes when you go see the doctor, he or she says what seems to be the problem. I'm going to tell you a little secret here that most people don't know. SOAP, that stands for soap. And that's actually the mnemonic in doctors' brains for beginning the conversation at the beginning of every doctor visit. So S is subjective. What did you come in complaining about? O is objective, what they found on an exam. A is for assessment, what they think's going on, and plan is what am I going to do about it. So if you think about it, if we always have a system that's problem-oriented, where you're always going to the doctor with yet another problem,
Right.
it's hard to get over the curve. We talk about prevention and we talk about wellness and we talk about optimal health, but I don't see prevention, wellness, or optimal health as part of the SOAP
Right.
mnemonic. So I think sometimes we all got to kind of change the paradigm, change our shift and say, hey, doc, I'm healthy, I'm 35, I'm 45, whatever it might be. What are some things that I can do on a daily basis, on a weekly basis, so I can avoid chronic illnesses
Right.
and live longer and live healthier?
I kind of chuckled because I just envisioned sitting across from a doctor.
Yeah.
So, what can I help you with today? Actually, nothing.
Actually, I saw the Ask Dr. Tell show.
I'm feeling
Yeah.
really good.
Yeah.
But I just thought I'd come and check
Yeah.
in with you.
I saw the Ask Dr.
Okay.
Tell show. He said to come in and
Right,
he
so
says
that's
like,
why I'm here. What should we do next?
and he says, who's Asked Dr. Tell? Yeah. Yeah.
It's kind of funny. Okay, well, we've got a Looney Tune over here.
Well, but I think that's, when you first pick your doctor,
Right.
you want to go in and say to him or her, how can we partner in my wellness plan so I can stay healthy during the year? And is it okay for us to meet every 3 or 4 or 5 months or even twice a year and develop
Just
my
to stay in
wellness plan
check.
and have certain goals about stress, about sleep, about diet, about mood, whatever it might be,
Right.
my energy level. It's not about just, taking down those 2-hour energy things. It's about why am I feeling this fatigue? I didn't
this
feel
time.
like this 6 or 7 months ago. And maybe I ought to check my thyroid. Maybe I ought to check my estrogen, my progesterone, or my testosterone level. So I mean, you got to look at it as a whole picture. I know we use that term holistic
Right.
healthcare, but it really is about looking at the whole body. And
Not
I'm going to tell you
specifics.
something that you're not going to hear. I think it's really important to talk with your physician about personal choices like your spirituality. I don't think one religion's better than another religion, but it's about we are all spiritual beings. And I think celebrating that spirituality that makes us feel human and
Right.
celebrating that relationship that we have with the universe, with God, with whoever we pray to or whoever we give thanks to for this miracle that we have as life. We're going to go to break right now. I'm Ask Dr. Tell. We'll be right back with you.
He's taken me through something that was a life-threatening illness and identified something that I don't think any other doctor would have. And because of that, I have 100% reliability in him.
Everyone deserves to have a physician that's their advocate, who's there for them 24/7. Call us, Ryan Ranch Medical Group, 647-3190. Let us be your partners in health and well-being.
You are listening to Ask Dr. Tell radio program, a presentation of MD Weight Loss. MD Weight Loss is a lifestyle program about regaining control over your health and life. Designed by the Ryan Ranch Medical Group, their weight loss team combines critical medical information with the latest FDA-approved prescription weight loss medications, education, counseling, and support, providing an individualized plan unique to your metabolism, body, and lifestyle. Being overweight is a medical problem that should be addressed by a medical doctor. MD Weight Loss is about losing fat and getting into the best shape of your life. Discover the lasting difference a physician-monitored weight loss program can make. Call today and make an appointment for a consultation at 831-647-3190. That's 831-647-3190. Thank you for listening to the Ask Dr. Tell radio program.
Welcome back. I'm Tell Franklin, MD, Medical Director for Ryan Ranch Medical Group with Ask Dr. Tell. I got Mira here. We've been talking about the importance of health and wellness. I think too often we talk about preventative health care, we talk about wellness, but we just kind of give it lip service. We talk about it in terms of getting a flu shot, getting your cholesterol checked.
Quick fixes.
Quick fixes. But what I'm talking about is how you can really optimize. There's a guy laying around on the floor here. We're really talking about how can we get ahead of the curve? How can we optimize the most powerful healing force in the universe, which is your own immune system. Nothing's more important, nothing's more powerful when it comes to avoiding chronic illnesses than your own immune system. So we hit on some good topics. You know, every time we, folks, I got to share with you, every time we go to break, Mira asks me these incredible questions, and I'm like, well, Mira, if you've got the questions, folks at home have the same questions. Why don't you ask me to get back on air?
Because he talks so much, I can't interrupt.
Okay, I'll talk slower. Okay,
so
go ahead.
I had a situation myself where my daughter was really sick, and because Dr. Franklin is a good friend, I have your home numbers, and I am a patient of his, so you offer that.
Right.
I've never,
Yeah.
prior to you, have had a physician say, here's my home number, here's my email, here's my cell number. Call me if you have a concern or a question.
Okay.
So is this a new wave medicine is going where doctors really want you to call them if you have a question, or is it just you? Because I don't have a Rolodex.
Yeah. I'll tell you a story. Is one day when I came to town about 12 years ago, I called a local physician, and I've never told him this, but it's a true story. I called a local physician about a mutual patient, and he said, if this is off after hours, here's my cell number, here's my home number. And I'll tell you, someday I should take him out for a coffee or
Absolutely,
and
because
say thank you very much. So I thought what a great thing. I think too often, patients can't get a hold of us, but if a patient of mine's got a problem, I want, so I
Right.
developed something called personalized health care. And so I spend 30 minutes with every patient that comes in. We do 90-minute physicals once a year, and every patient's got my home number, my cell number, and my backline at the office, and I'm available to them. And I'll tell you something, I sleep better at night knowing that if any of my patients need to get a hold of me, they can. People are extremely respectful. I could tell you that maybe once every other year I get woken up in the middle of the night, and usually it's something that I needed to be woken up for in the middle of the night. But I love it. My patients are kind of like an extended family. I really enjoy them. I love that you're my friend. I love that you're my patient. I want to be there for you. That's just,
Right.
What I do is really not a job. It's really something that I feel very passionate about. If you want me to tell you the truth, when I was a little kid, about 7 or 8 years old, my grandmother used to take my hands and go like this. Someday these will be doctor's hands, and I'd say, Nana, I want to go play. So I just love.
I'm gonna ride my bike.
I just love, I mean, I enjoy my time off. I'm very athletic, so I go up to Garland Park. I go to Jack's Peak, across from the studio here.
Every gym in town.
Yeah, I go to.
I pass them on the road.
Yeah, and oftentimes people will come up to me at the gym and say, "Are you still taking new patients?" Or "Thanks for helping my husband," or "Thanks for seeing my son or my daughter when they were home from college." But I'll tell you something, it adds to my life. It makes me feel more valued, needed, and I really enjoy what I do. So for me, I know it's a job, and I know this is how I make my living. But I really enjoy being a doctor. I mean, I'll be honest with you. If I won the lottery tomorrow, I'd still go to work. Although I would take 2 weeks and go to Hawaii and celebrate a little bit. But,
well, we
but I
appreciate
enjoy
it, and it's
Well,
one of
thank
those
you.
things that is now a priority for me.
Well,
so if
if
you
you-
ever retire,
Yeah.
I need a doctor that where I know I can call, and I'm not going to abuse it. And
No.
that, I mean, I called you on Sunday morning.
Yeah, but if you really
But-
think about it in terms of, it gives value to my life too. I mean, I
Right.
enjoy being there for people. I think the greatest blessings in life is to enrich other people's lives and to really give back. I think anybody who does any kind of volunteer work or anybody does any kind of service, ask policemen, ask firemen, ask the local city councilman or woman, ask anybody that's any kind of civil service, and they'll say, I enjoy people, I like working with people, and I help partnering with people. I'm going to tell you a little secret. I think oftentimes we live our lives as if we're isolated human beings. But I think one of the biggest secrets in life is to acknowledge, celebrate, and appreciate the connections that all of us have. And by acknowledging those connections, it gives more value to our lives and helps us to live more passionate lives. I got
Well-
a story I got to tell real quickly. Do my
On a different note-
Okay.
We do need to congratulate you.
Congrats.
Dr.
Yeah.
Franklin's office has been nominated with CHOMP and Salinas Valley Memorial Hospital for the Chamber of Commerce Award.
Yeah.
That's-
Outstanding healthcare in Monterey County. So
That's quite
yeah.
an honor to think that you're competing with hospitals that you give that type of care. So, congratulations.
You're
And I
welcome.
think you've already won. I
Yeah,
don't know. I mean,
thanks.
come on, you're an office compared to a hospital.
Yeah,
So,
well, thank you.
Thank
And-
you.
And I should tell folks that Monterey Chamber of Commerce is an excellent, organization in town. They do so much for,
Supporting the
supporting and everything. So
businesses
they are having a dinner, I think Thursday,
July 28th.
July 28th at the Monterey Conference Center. Maybe we can put up on the website their phone number and website so people can go to montereychamber.com or
Right, and
.org.
thank you for voting for him.
Thank you
on
for,
his
yeah.
behalf.
But I
just
do got to
think
tell
it's
you
such
is
an
that
honor.
Ryan Ranch Medical Group is made up of myself, Dr. Carnazzo, who's been with me forever, Dr. Navino, Dr. Sun, Dr. McFarland, Dr. Steinbaum, Dr. Martinez. Got to make sure I didn't forget anybody.
And all the help in the office.
Yeah, I mean,
it's like
we
a
really
family.
worked.
It
Yeah,
really is.
we really work well as a team, and I think that's made a big difference. Whether it be the medical assistants, the receptionists, the nurses, our billers, it's really a family organization.
And obviously, your patients feel that and they see that, and that's.
Well, I think it's important. Life can be a lot of hassles. It's important when you come into an office that you get excellent customer service and you see the best doctors that are available. And I try and greet every new patient that comes in and make sure that they know that if we don't exceed their expectations, they give us a call.
Well,
do
sounds
I have
like you've
time to
done
share with
that.
you a real quick
Yeah.
story? So I got a letter here, and I just want to paraphrase it. As I was walking here in today, I got a letter, and it says, Dear Dr. Franklin, I saw a woman in my office about 6 months ago. She had just gotten a second opinion by going to a local cardiology for PVCs, and folks, that's premature ventricular contractions. When I saw her in follow-up, she did not bring in her medications, and I had yet to receive the consult note from the specialist. 10 days later, she died in her sleep. He says to me, he's so distraught over it. And I think that the lesson to be learned is too often we go to physician after physician and there's little or no communication between the primary care doctors and the specialists and even the specialists among themselves. Too often we're carrying around a plastic bag with medicines, and nobody's ever taken a look. So here's the thing. I want you, if you don't learn anything else from this hour's show, is take your medicines all your medicines, put them in a bag, keep them in the jars they came in, and take them to every doctor visit. And at every doctor visit, ask your doctor to go through them. Even if he or she says, oh, there haven't been any changes, you never know about another specialist who's added a medication or substituted a medicine. And I'm going to tell you, folks, every once in a while, I think the pharmacy industry does an excellent job, but it's still human error. I do find the wrong medicines in the wrong jar, or medicines that sounded like something every once in a while. So these are things that we take, and they can really mean the difference between life and death. So the lesson is, when you go to see specialists, when you go to see other doctors, and every time you go to see your family doctor, always take your medicines. I'm not talking about writing a list. I'm not talking about writing them down. I'm talking about actually taking the jar. And folks, do not take your pills out of your jar to put in another jar that's not being used for something. It's one thing if you want to lay them out for the week, but take the jar that the medicines came in, and additionally take all over-the-counter medications with you, and take them and ask your physician at every single visit to go through them. If you're no longer using a medication, discard it. Ask the physician to discard it. This can be a life-saving situation. Statistically, it's been shown over and over again, anyone that's on more than 2 or 3 medications, oftentimes what we're seeing here is drug-drug interactions. It's up to your pharmacist, it's up to your primary care physician, it's up to your specialist to review these medications as often as humanly possible. I cannot overemphasize that. These medicines have to have their liver checked, have to have your electrolytes checked, have to have your kidneys checked, and nobody can read anybody's mind. Oftentimes we assume, oh, he knows that I went to see that person. Oh, he knows this, or he checked with my pharmacy. This is your health. This is your life. This is your well-being. Make sure that at each visit you take all your medications, keep them in the same jar. And I know you're thinking out there, he's being very repetitive. I'm being very repetitive on purpose because this is critically important. Take all your medicine to every doctor visit and insist that your doctor at each visit goes through and gives you an understanding of why you're taking each medication, what times of the day, any type of nutritional supplements you need to take along with it, and make sure that there are no duplications. Oftentimes, very similar medicines can have different generic names or other trade names, and sometimes these names can be very confusing to the layperson. So I want to insist that you take them to every visit. Okay? Are we running out of time here? How are we doing here? 1 minute. 1 minute. So I want to tell you is thank you so much for being here today. Thank you so much for inviting us into your living room. There's no way to really appreciate the miracle life than to live life with passion. And that ticket to really live life with passion is to be healthy. Find a family doctor. Find a primary care doctor who you can partner with so you can really appreciate the journey of life, so that you can be a better mother, brother, sister, coworker, so that we can really make a difference. By all of us understanding, celebrating, acknowledging the connection that we have, we live fuller lives, society benefits, the world benefits. Good luck. God bless you. See you next Friday.